What I remember from undergrad is just knowing that my parents told me to do what I loved. And I wasn't familiar with medicine. I didn't have family in medicine. And as I thought about what I would actually do with the degrees I had and what I had studied in undergrad, I realized that medicine was something that would be fulfilling for me and that I could enjoy day in and day out. And so the earlier that students, medical students, get involved in service and community outreach, the better equipped they are as physicians to make those improvements and to do that on a broader scale. HOPES is the Health Outreach Partnership of EVMS students. It's a free clinic. It's a student-led free clinic in Norfolk. And actually, it's the only student-led free clinic in Virginia. It's actually a fully fledged primary care clinic with a number of specialty clinics as well. It operates 2 nights of the week for about 1/8 of the time that a general medical clinic would operate in terms of private practice. It has a panel of about 500 patients, and HOPES is the primary care provider for those 500 patients. And the students do everything. There are attending physicians who serve as kind of the ultimate arbitrators of decision making in terms of the medicine, but students make the appointments, they arrange the follow-up, they deal with any challenges that the patients face in terms of utilizing this access to healthcare, and the patients face a lot of challenges in that sense. So students are very heavily involved, and it's basically all student-driven. One patient who I really admired, though, and he, among others, encapsulated what to me is the fact that the patients who face these barriers are incredibly strong. This particular patient, though, he came into clinic, he was a middle-aged man, and he said, "You know, I don't know what it was, but I had a surgery when I was a child. And ever since then, I've had diarrhea every day of my life, no matter what I eat. I've never been able to stop it. I wasn't able to graduate from high school. I couldn't work. In fact, it took me a long time to get on disability because I couldn't make all the appointments that I needed to make." All of which was kind of a heartbreaking tale in and of itself, but as we finished the visit and started to arrange his outpatient care, the rest of his outpatient care, and his follow-up with us at HOPES, he said, "Oh, well, we'll have to pick a specific date because I need to fast for 3 days before I come into my appointment because I can't take public transportation otherwise without suffering from incontinence." And then he told us after we asked, that's exactly what he had done for that appointment that night. He hadn't eaten in the 3 days prior, just so that he could make it to HOPES. And what struck me not only was his strength, but that he had done that so that we HOPES and we EVMS students, and I use we in the broadest sense, he had done that so that we could treat him. And that was an unreal feeling that he had gone through all that effort so that we could be the ones to provide him with care. I mean, it kind of blew my mind. It was almost hard to realize that that was what was going on. I think just that psychological impact is huge. For patients to know that they're not alone, that the institution of EVMS and the teaching hospitals that support EVMS and are connected to it are all there trying to improve their individual health and the health of the communities that surround them as well. It's quite emotional to see it all work out.